Afternoon. My name is Katherine Kleban. I am the audiologist at Valley Hospital. Hopefully everyone can hear me and see me okay. Um, I work at the Center for Child Development, and that might be a little bit confusing for some people because uh, we're called the Center for Child Development, but I'm the only one in this department that sees adults. So I um, treat hearing loss for adults and children, essentially the entire population. So I have a little bit of a presentation I wanted to share with you. So let me get that going. Okay, here we go. Let's see if I can do this okay. There we go. Okay. Financial disclosure, I am a full-time employee of the Valley Health System, Valley Hospital. So what's an audiologist? An audiologist treats, monitors, and diagnoses balance system and hearing disorders. We have training in anatomy, physiology, cochlear implants, acoustics, auditory rehabilitation, amplification devices, electrophysiology, and psychophysics. Qualifications for this career include an advanced post-secondary training and state licensure. So I am licensed in the state of New Jersey as an audiologist. Um, and you can read the screen too. There's some things I missed. So what's a hearing aid dispenser? You might hear about a hearing aid dispenser as well as an audiologist. So I am also licensed as a hearing aid dispenser in the state of New Jersey, as well as an audiologist. However, hearing aid dispensers are not always audiologists. Some of them only have to have a high school degree or maybe a little bit of college. So an audiologist does have more advanced training. Almost all of us have doctoral degrees at this point. There might be a few master's degrees out there, but we have a lot of education to help you hear better. Some statistics about hearing loss. About 15% of American adults aged 18 or over report some trouble in hearing. 1 in 8 people in the United States, 12 and over, have hearing loss in both ears based on standard hearing evaluations. Hearing loss is the third most common chronic physical condition in the United States, and over half of people in their 70s have some degree of hearing loss. Hearing loss and aging. Presbycusis is the name that we associate with hearing loss, age-related hearing loss. It occurs slowly over time. It's usually in both ears. It's not too common to have it in one ear at a time, but it affects a person's ability to understand speech and regular conversations. Sometimes older adults may deny that they have hearing loss, and many people are aware that their hearing is deteriorated, but they are reluctant to seek help. Only 20% of people who have hearing loss seek out help. Untreated hearing loss can cause emotional and social effects. You may be ostracized from your family and friends. Let's say you're at a dinner with your family and you can't hear them. So you might just kind of curl into your own little ball and not pay attention, not want to participate in the conversation because you can't participate in the conversation. You can't hear others. You may also limit your social activities if you can't hear properly, and you have an overall decrease in feeling of good health overall. Okay, social isolation, a little bit more into this. It may cause, untreated hearing loss may cause confusion, isolation, depression, and embarrassment. There's a lot of things associated with untreated hearing loss and social isolation. It can cause reduced alertness and increased risk of personal safety. This is quite important. Let's say there's some things going on. Maybe someone's coming up behind you, or You don't hear an ambulance coming by or a police car coming by, even though they are quite loud. Or let's say someone's whispering to you. It's all a risk of personal safety. Hearing loss and dementia. So this is just a nice little slide from healthyhearing.com, which is a really nice resource. Dementia is more common in people with untreated hearing loss. You may have already heard this, that memory loss and dementia is linked to hearing loss. There have been a lot of articles in prominent newspapers and online about this. People with untreated hearing loss tend to develop cognitive decline earlier than peers with normal hearing. And people with untreated hearing loss report more concerns about their memory than people with normal hearing. So, yes, hearing loss and dementia, there's a connection. Research has shown that hearing loss can cause atrophy to the brain at a faster rate. Social isolation from hearing loss disengages you from conversations. Some factors that contribute to dementia. Let me preface this first. There are different degrees of hearing loss. There's normal hearing, and then you have a mild loss, then a moderate loss, moderately severe, severe, and then profound. Profound is can't really hear much. Maybe you could hear a gunshot or a really loud ambulance going by. But that's quote unquote what deaf people hear. So when you have a mild hearing loss, it can double the likelihood of dementia risk, which isn't a lot of hearing loss. But what I like to say is hearing loss is hearing loss. Most people have normal hearing. So if you have hearing loss, it is significant. When you go up to a moderate hearing loss, you can triple your likelihood of a dementia risk. And then once you go down to a severe hearing loss, you're 5 times more likely to develop dementia. And this is all compared to your peers with normal hearing. Hearing aids may delay the onset of dementia. There is a lot of evidence that it does. You're basically using your brain more often when you're using a hearing aid because you're hearing more. This is an ongoing research topic. And people who struggle to hear speech and noise are more likely to develop dementia than those with normal hearing, basically what I said, but speech and noise specifically. No questions. Okay, good. All right, cognition and hearing loss. When you're struggling to hear, you're straining your brain, and that creates a cognitive load. Your brain is changing structurally and physically when we have hearing loss. There is a lack of auditory input going in because you're not hearing everything properly. This is a modifiable risk factor. You can treat hearing loss, which I will get into a little bit more in a couple minutes. But if you could decrease your likelihood of dementia or memory loss, would you do it? My answer would be yes. If I could decrease my risk of getting cancer, absolutely I would. Okay. Then just a little bit about noise-induced hearing loss and prevention. Noise-induced hearing loss is permanent. It can build up over time, but it is preventable. Typically over time, there are loud sounds that maybe you went to concerts, maybe you worked in a noisy job, like a factory, and you didn't have hearing protection. Only more recently in the last 20, 30 years has OSHA put in proper protocol where you have to use proper hearing protection at work. So not everyone does, or maybe you're a veteran or you've served time in the military or anything like that, you might have some residual noise-induced hearing loss. Some ways to prevent it, you can wear hearing protection, earmuffs or earplugs if you can't leave a noisy place. So for example, let's say you are mowing the lawn and you have a really noisy lawnmower or blowing leaves, something like that. My patients have asked me, what should I wear, earmuffs or earplugs? If you have both, wear both. That's more hearing protection. The more you can prevent hearing loss, the better you'll be in the long run. Some other things: lower the volume. You can set the volume on electronic devices to a level that allows you to still hear what's going on around you. What I like to say is turn it up about halfway. And if you can still hear things around you, you're okay. If you can't hear your music or whatever you're listening to, turn it up in small increments. Don't blast it. You might see people on the streets wearing ear headphones or things like that, earbuds. And if you can hear their music, it's too loud. If someone else around you can hear something that you're listening to, it's too loud. Another way to prevent noise-induced hearing loss is just moving away from the noise. Put some distance between you and the noise source to reduce the impact on your ears. Because again, once you lose your hearing, you can't get it back. There's no magic pill, unfortunately. They're working on it, but there's no magic pill right now that will allow your hearing to come back. So some signs you may have hearing loss. This is one, unable to hear the turn signal. This is one that my father is 65 years old, and he constantly tells me, I can't hear my turn signal. That's a high frequency sound. That's actually where age-related hearing loss starts out, in the high frequencies. That's where you lose your hearing first. So sometimes I question when I'm on the road and I see someone having their turn signal and they're not turning. I'm saying, what are you doing? Why are you not turning? And I wonder if they just can't hear it, because that is a common sign that you have hearing loss. So you might see it, but you might not hear anything. There's always a sound when you have a turn signal on. Some people might say that other people are mumbling. If you ask what or how frequently, tinnitus. Tinnitus is an umbrella term for ringing or sounds in your ear. It's a very complex topic. It typically goes hand in hand with hearing loss. You can have one without the other, but they do tend to go hand in hand. So if you have hearing loss, you may not have tinnitus, but it is common to have both. Some people say, oh, there's only one person I can't hear. And then they test their hearing and they have hearing loss. It's because, okay, maybe you hear other people one-on-one fine, but there's just that one person you can't hear. This is what I hear all the time. My wife, husband, spouse, partner says I can't hear. When I go in to do a hearing test, I say, what's the reason you're here today? My wife told me I have to go. Or my husband said I can't hear him. My husband said I can't hear her. Another one, difficulty hearing grandchildren. They have high-pitched voices. I have a high-pitched voice as well. And like I said, high pitches are the first ones to go, and it can be difficult to hear for grandchildren. Difficulty hearing in a car. First of all, you're facing forward, so you're not looking at that person. You're not getting lip cues. You're not getting gestural cues. And there's sound going on. A car can be noisy. Difficulty hearing in complex environments. Number one place where people have difficulty hearing, a restaurant. Some people have difficulty hearing at places of worship, at church, meetings, grocery store, coffee shops, any place that has noise involved. It can be difficult to filter out the speech that you're trying to hear. Another sign of hearing loss, taking charge of the conversation, not allowing other people to speak. It's pretty common. Okay, so hearing loss can be linked to other health conditions. I'll just read them off. Cardiovascular disease, Alzheimer's and dementias, which I already mentioned. diabetes, hospitalization, that is pretty common, 32% more likely in older adults with hearing loss to be hospitalized. Mortality, hearing loss is tied to greater risk of dying for older men. Chronic kidney disease, falling, hearing loss is tied threefold to risk of falling. The hearing organ and the balance organ are connected behind your eardrum. So when you have balance issues, we always do a hearing test to make sure that everything is okay in your hearing organ, the cochlea. And that's why sometimes you might go to the doctor or the ENT with dizziness or balance issues, and they might give you a hearing test. That's also a way that we can find out a diagnosis for you, why you're falling, why you're having this dizziness or vertigo. And last but not least, depression. Your symptoms might go down, your quality of life goes up with hearing aid use, which again, I'll get into in just a couple minutes. So some communication strategies. These are things that you can do without the use of assistive technology. So don't bluff. If you can't hear someone, be an advocate for yourself. It may take some time to come to terms with your hearing loss, but don't be afraid to tell people that you have a hearing loss so they can adjust to the situation. Plan ahead. Try to pick a quieter restaurant. Avoid sports bars. Carpeted restaurants absorb sound better. Restaurants with more light will also allow you to see your communication partner's face, therefore making it easier to see their lips. Sometimes it's also good to sit with a wall behind you so that there's not any noise behind you. Typically, when you just tell a host or hostess if you want to be in a quiet area, they're quite accommodating. Don't try to shout from one end of the house to the other, or try speaking with someone that's in another room. So I have normal hearing. I'm in my 30s, and my husband's in his 30s as well. We both have normal hearing, and I constantly have to tell him, come into the room if you want to talk to me. I'm sure some of you are shaking your head. Yep, my wife, husband, child is in the other room, and I can't hear them. It's okay that you can't hear them. You know, there's a wall, there's a door blocking the sound from going in, and people should be more cognizant of getting the attention of the person that they're trying to speak with by going into the same room. Okay. Okay, I just mentioned this. Try to get your communication partner's attention. Some examples include gently tapping on the person's shoulder, or making sure you're in front of the person, allowing them to know that you're ready to talk to them. This allows you to see the person allows you to see the person you're talking and able to see their lips and gestures. So instead of using one-word questions like huh or what, try to rephrase using the same information that you gathered. Like, what was that you said about the directions? Or what did you say about John? This may increase communication by decreasing emotional reactions. So both parties must learn to be patient. Sometimes it's important to ask for written cues if needed and to concentrate on the speaker. No one is going to be upset with you if you bring maybe a whiteboard or if you ask someone to write something down. I do it constantly with my patients because they have hearing loss, so they can't quite understand everything I'm saying. Pay attention, remember to listen. Sometimes we dominate the conversation, as I said previously, because we're compensating for not being able to hear. It's important to overall stay positive and maintain a sense of humor. Try to take a deep breath, relax yourself, and try instead of immediately getting frustrated because you can't hear. And I know that's easy for me to say, but sometimes we just have to practice a little bit of mindfulness and take some deep breaths. We're only one person, you know, try to add some humor if you can. So some treatments. Hearing aids are the most common treatment. They continue to improve. They're connecting to your cell phones now. You can even use them as headphones. You could go for a run with them and listen to music. Be careful that you are aware of your surroundings and the music is not too loud, but they have some really nice advanced features. Cochlear implants, it depends on your degree of hearing loss. That's more for severe to profound hearing loss, and you have to get a consultation with your neurologist because that's someone that would do a surgery. And then surgery, it also depends on the type of hearing loss. If you have a mixed or conductive type of hearing loss, it's basically an issue in the middle ear, a mechanical blockage of sound. Maybe you have like a tumor in your ear that needs to be removed. Sometimes if you have a lot of ear infections, is there a question? Let me see. Should you see an ENT physician before seeing an audiologist? You don't have to. You can see an audiologist first because the ENT will want that hearing test. And a lot of audiologists work at ENT practices, so they might schedule you for a hearing test before you see the ENT anyway. Okay. Hearing assistive technology. So there are some things like headphones that you can obtain when you're going to, let's say, a Broadway play, or, well, it doesn't have to be a Broadway play, but there are a lot of places that adhere to the American Disabilities Act that you can get hearing help in this. There are things that can be built into the hearing aids themselves where you can hear better in certain places. There's something called a T-coil that's built into hearing aids, most hearing aids. And what it does, if you're in a place that has a loop system, it goes into like a magnetic field and it kind of links you into their speaker system. So for example, when I go to my Wegmans, I know that they have a loop system. So you can turn on your T-coil and you can hear the announcements right into your hearing aids, which is pretty cool. A lot of museums, public places, meeting spaces have them, places of worship. You have to check with your place of worship, of course. But a lot of theaters do have this special technology. And something that's absolutely free is closed captioning and subtitles. You just put it on your TV. If you're having any trouble putting it on your TV, you can have a child help you out, or you could even call up the company. I'm sure they'd be happy to help you. It's quite easy to do. You just go into the settings and do so. I have normal hearing and I put it on all the time because I don't miss anything. It's wonderful. I'll just go to the questions. Good question. Okay, I'm going to read it out loud. I rarely have met someone who is satisfied with their hearing aid. There are so many now on the market. How can we know which hearing aids are legitimately helpful? Let me go to the next slide because I think I have that on here. Okay. So hearing aids are extremely sophisticated devices. That's why they cost so much. They're not just turning up the volume. They are programmed to your hearing loss, so you're only getting amplification where you need it. They're also sophisticated in the sense that they will know where you are and they will automatically turn down the background noise, the noise in the background. It's not a perfect system because we can't replicate your ear, unfortunately, the way your ear hears when you were a child. But it is important to see someone that is reputable, an audiologist that has experience with these things. And if you have hearing aids and you're not happy with them, go back. They have to help you. It is their job to help you. The more specific you are about your issue with, let's say, oh, the papers are too loud, or I can't hear my grandchild. The more specific you are, the easier it is for us to help you. So there are many different ones on the market today. You're absolutely right. Um, but an audiologist has experience. You tell the audiologist what your issues are, and they can figure out which one is best for you, because we typically use about 4 different companies, um, and each one is different and better for different people. So if you have maybe a severe hearing loss in the high frequencies, okay, I'm going to put you with this company. Or if you have a low pitch hearing loss, I'm going to put you with that company. Or let's say I have a certain kind of cell phone that I use. We can put you with a certain company that you can use them, and you can adjust the hearing aid with your cell phone. Let me go to the questions. Okay, good. So I wanted to also mention a common barrier is I don't want to look old because I have, I don't want to look old. I don't want to wear hearing aids. I see babies as young as, I mean, a few days old that are that we put hearing aids on. I see teenagers. I see 20-year-olds. I see the entire population. Everyone has hearing aids. And of course, yes, I'm biased. I see mostly people with hearing loss, but sometimes the question is, you are too young not to hear. So do you really want to go through life missing things because you don't want to look old? See, there's a question. Here's one being advertised on the radio where an audiologist is adjusting their brand remotely. Is this a routine feature now? Okay, yes, it is actually pretty. Since COVID happened, they did have this feature where you can have a virtual appointment with an audiologist where we can go into your hearing aids through your cell phone when it's connected to your cell phone, and we can adjust it that way. So you actually won't even need to come in. You'll need just your cell phone, a smartphone, and we can adjust it that way. But it is a really cool feature, and people are quite happy with it because you don't have to schlep over to the office just to get a minor adjustment. And like I said, it is important to get adjustments to your hearing aids, because if you get your hearing aid and you're not happy with it, you are less likely to wear it. And the goal is for you to wear it as often as you can. So no showering, sleeping, or swimming with them, but all other waking hours. The reason why you wear your hearing aids all the time is because your brain gets confused when you take them on and off, on and off. They don't have time. Your brain does not have time to adapt to that sound, and you will never hear as well as you could hear. It does take some time to adjust, but if you're wearing them appropriately and enough, maybe a week or two for you to really adjust to the sound, because initially it can be quite loud when you put them on because you're not used to hearing it. These are all the sounds you weren't hearing before. So your brain, again, needs time to adapt and adjust to the sound it wasn't hearing for so long. Okay. So going back to hearing aids.
Catherine, it's Sue. Somebody had mentioned something about a hearing aid called Hearables. Have you heard of that? I have not. Looking it up.
Okay, so there are a lot of over-the-counter amplifiers that are on the market right now. I would be extremely, extremely cautious before purchasing one of these. The reason being that if you don't have a hearing test programmed into that hearing aid, amplifier, whatever you want to call it, it just puts loud sound, more sound in, and it doesn't make speech clear. It just makes everything louder. So let's say you put on that amplifier and you go to the grocery store. You are going to hear every single thing in there. You're not going to hear the speech that you want to hear. You're going to hear every single thing. And this can actually be more damaging to your hearing because think about it, noise-induced hearing loss, too much noise, you're putting more noise in, you can damage your hearing further. So be extremely, extremely cautious about purchasing these things. It's really not recommended. You should have, we'll get to the cost in a couple minutes, but overall, be cautious. If you can't afford anything, it's better than nothing, but absolutely be cautious. So like I said before, only about 20% of people with hearing loss seek help or treatment. I personally feel that that number is going up. Previously, I was seeing a lot more, I see adults here, yes, but previously I was seeing almost only adults with hearing aids. And the younger people that have hearing loss in their 20s, 30s, they really want to be part of the conversation. They do not want to be seen as dumb or stupid because they can't hear something. They want to be engaged. So a lot more people are actually seeking help and treatment, along with the fact that, how am I doing on time? Sorry, let me check. Okay. Along with the fact
You're
that
fine.
everyone is wearing masks now. We didn't know that we were lip reading so much. Even if you're not a master lip reader, I am certainly not. You need those cues, and it is difficult for you to hear with a mask on. Plus, you have a barrier. Someone is blocking their mouth. You know, that's reducing the amount of sound that's going out. Let me just go to the questions. How do I choose the best audiologist? That's a good question. Find someone that has accreditation from the American Speech and Language Hearing Association, ASHA. So behind our name, behind my name, it says CCC-A. That's a clinical certificate of competency in audiology. It's quite important that you get someone that has that, or FAAA, something like that. That is a fellow of the American Academy of Audiology. That means that that person, that audiologist, is getting their clinical, they're continuing with clinical education, and because they have to. And so they are up to date on the latest research. You don't want someone really stale. So a common place where there are hearing aids are Costco. Some of them have audiologists, some of them have hearing aid dispensers, so you have to be cautious. I'm not saying anything against hearing aid dispensers, but some of them just don't have the experience and they don't understand the anatomy, physiology, all the causes, the etiology of hearing loss. So it's important that you find someone that understands audiology and hearing loss. I hope that answers the question. Let me go back. Oh, let me see what. Oh, something I also wanted to mention about hearing aids. There are a lot of really good rechargeable solutions now, but there's also the option of having batteries. Some people feel that batteries aren't that great. I don't mind them because if you forget to charge your battery, you just change a battery and you're good to go. If you forget to charge your hearing aids, it could take up to 3 hours to charge them. So you might miss something important. So it's not the worst thing in the world, but if you like rechargeable option, it's there. And they tend to be a little bit more water resistant. Hearing aids are water resistant, not waterproof. You can't, like I said, go showering or swimming with them. But if you tend to sweat a lot, we can find an option that's rechargeable. I think there's another question. Should I feel comfortable using Costco if they have an audiologist? You should probably be fine. The one over here, I think it's T-Neck or Tenafly, Teterboro, that's the one that's close by. They have, I've heard really good things about their hearing aid dispensers. Let's talk about the difference between Costco and going to, let's say, a hospital or an audiology office. So Costco, yes, their hearing aids are cheaper. Sometimes you get things that have been on the market for a while, so you have older products. That's not always the case. I don't work at Costco, so I don't know. These are just things that I have seen in the past. But yes, they are cheaper. I think they range around 1,000 to 3,000 for a pair. If you go to a private practice, an ENT office, a hospital, they can range from anywhere from $3,000 to $7,000. You will get better service if you go to an audiology practice, ENT hospital, rather than going to Costco. It is, if you think about it, it's a medical environment versus somewhere you get paper towels. So, you weigh the good with the bad. And there's pros and cons to both. Yes, one's more expensive, but you're getting better services and you're likely going to be happier with your experience and your hearing aids. Okay. Oh, I hope I didn't press it again. Okay. So most senior citizens have Medicare as their primary insurance. Medicare will cover the cost of the hearing test. You get 2 hearing tests a year. You typically need a referral from your primary care physician. Unless you go into an ENT office. I apologize, I don't know for sure. I don't think you need a referral then, but you may still. I know my grandmother needed a referral when she came to an ENT office. Medicare does not cover hearing aids. I don't see them covering them anytime soon. It is absolutely ridiculous, in my opinion. They should be covering them. But unfortunately, right now, they do not cover hearing aids. Over-the-counter hearing aids, that's what I wanted to talk about previously. A little bit of a spiel here. So hearing loss is a very complex medical condition. Again, hearing aids don't just make sound louder. An audiologist needs to adjust the hearing aid and program the hearing aid. Without a test, over-the-counter hearing aids make things unnecessarily loud and again, can damage your hearing further. Traditional hearing aids will adjust for background noise. Over-the-counter tend not to. There are a few that are somewhat sophisticated these days, but overall, they're not going to be as good as the hearing aids that we dispense, for example, here. Experience allows audiologists to choose the best technology for you and your budget. It's not like buying a car. It is a medical device, so that's something to take into consideration. Because, there are different levels of hearing aids. And I don't like to compare it to a car like a Lexus or a Honda. Basically, as you go up in price, they will reduce background noise better and improve speech and noise and speech intelligibility overall. Something to keep in mind when you get your hearing tested is speech discrimination scores, word recognition scores. This is when the audiologist turns up the volume and says words and you repeat them back. And you get a score for how many you get correct. A good score is like 84% and above. And if you get that, or even 80% and above, you would do well with hearing aids. If you are poor, let's say 64%, lower, hearing aids can be more difficult for you to hear things with. So that may be the reason why someone is not satisfied with their hearing aids. But it's important that you understand before you get the hearing aids that if you have poor speech understanding, you're still not going to hear amazing with the hearing aids because it's nerve damage. And when you have nerve damage, my example is when you turn up a broken speaker, sure, it gets louder, but you still can't understand it. There's still distortion. And that's kind of the same thing when you have nerve damage. You turn up the volume, but you still don't quite hear every single word. That being said, something is better than nothing. So a hearing aid is better than nothing because you will still hear more speech than you would without anything. Because the goal of having hearing aids is to hear speech, right? So hearing aids, yes, they're expensive. I know. They can, again, range from $3,000 to $7,000 for a pair. Your audiologist would work with you to figure out the best. Not everyone needs top of the line technology. It depends on what you need, what you're doing, if you're retired, what you would like to hear. It's always best to check your secondary insurance to see if you have a benefit. Important things to ask: how much are you giving me per ear? Because sometimes they'll say only one ear, which doesn't make sense. You have hearing loss in 2 ears, you need 2 hearing aids. For how many years? Sometimes it's every 3 years, sometimes it's every 7 years. It just depends. So it's important to ask. Also, make sure that you get a reference number and the name of the person you spoke with on the insurance. And also ask if there is a particular clinic that they participate with, because maybe you want to come here, but that we don't participate with that insurance. So just make sure. So your first step, if you feel like this is resonating with you, if you feel like maybe I don't hear so well, contact an audiologist, contact an ENT, speak with your primary care physician to see if you need to get a referral. You can always call your primary care to see if you need a referral or not. Let me just go to the questions. Oh, sorry, missed one. Costco doesn't say who makes theirs. Okay, let's get into a few of these things. Typically with the price of hearing aids, you get a warranty period that's, and you loss or damage coverage. It depends on where you go, what the exact loss or damage coverage or warranty is. So with our hearing aids, they come with a 3-year repair warranty and either 2 or 3-year loss or damage coverage. Your follow-up appointments are all included, and that's typical for most places that you go to with an audiologist. All your follow-up appointments are included, bundled in the price of the hearing aids. Your hearing tests are covered through your insurance. I'm not really encountered insurance. Been doing this for maybe 9 years, 10 years, and I haven't experienced an insurance that won't pay for a hearing test. Product demonstrations, yep, we include that as well. Audiologists include that as well. Remote services, absolutely. Audiologists will do that. Premium technology, yes, we truly, audiologists work with the highest end technology there is because it will help you hear better. It's not like we're trying to just sell you something. I get paid whether you get a hearing aid or not, does not matter. I'm just here to help you hear better. Yes, you're going to get premium technology. Again, just be wary that it's not older technology. I don't know exactly who makes the hearing aids for Costco. I have heard that it has been some of the companies that we may use. But again, be wary. Ask questions. It's your right to ask questions. If you're going to pay for something, ask questions. It's important. Okay. peer support. Let's say you have hearing loss and you want to connect with others that have hearing loss as well. The Hearing Loss Association of America, I apologize, I spelled that wrong. The Hearing Loss Association of America has chapters typically within each county. I've been to Morris County meetings. I have not been to Bergen County, but they have meetings, and it's a nice support circle where you can talk about things and ask questions. However, don't ever be afraid to ask questions to your audiologist. If they're cutting you off and they're not giving you the time of day, go somewhere else. It's your right, it's your health. So this is just some information about the Bergen County chapter. These are my references, and this is my information. If you wanted to come and schedule a hearing test, you can call our main line and do so. But I'm happy to answer any other questions. I am an open book. I actually really like questions. It makes it easier for me to answer rather than just talking at you. So please feel free if you have any other questions to ask them.
Oh, thank you so much, Catherine. That was great. So comprehensive and clear with some really good information.